We, of course, all feel like we deal with general aches and pains, but what if there's something more to that pain? You may be suffering from arterial disease. I traveled to RIA Endovascular and sat down with Dr. Nishant Patel to find out more. Dr. Patel, thank you so much for having us here at RIA.
Thank you for coming.
Of course,
always welcome.
Yeah, we love being here. Okay, so you're an interventional radiologist. Tell us what that is.
Well, we're a specialty within radiology. We use imaging to do procedures, treat diseases that used to be done with open surgeries. So it's a lot less recovery, much more minimally invasive, often done without anesthesia, not needing to be completely asleep, and sometimes even done right here in our interventional suite in our office.
Amazing. You're making things so much easier for people. I know people are very happy to hear that. So what types of procedures do you guys perform?
Well, honestly, we do a lot of work in the vascular system, veins, arteries, but we do treat back fractures, we treat varicose veins in the legs, we treat cancers of the liver, the kidneys, the lung, so a really big variety of procedures, basically from neck to foot.
Amazing. Well, obviously we know that, not having to do full-on surgeries and procedures is a huge benefit. Are there other benefits to interventional radiology?
Yes, I mean, just in general cost. I mean, it's cheaper to do things without needing anesthesia, with less recovery. We can do treat patients not in the hospital, just in our office, saving time for the patient,
yes,
preventing them from going to the hospital, potentially getting hospital-acquired diseases like pneumonias. Also, just recovery time. I mean, patients are off their feet, out of work much less when we do procedures for them.
I know that that's huge for people listening right now. They're like, less recovery time is always better for us. Is there a particular procedure you'd like to talk to us about today?
Well, today we kind of can address peripheral arterial disease. Okay. It's a bad disease of arteries, generally the legs, and we treat a lot of those patients, but unfortunately it's very under-recognized, but can be a huge problem for patients.
Okay, so what are some of the symptoms people should be looking out for?
Sure, the mildest symptoms are usually walking brings on some kind of severe pain in the legs, or in the hips, or in the thighs, or in the calves most commonly.
Okay.
But it can progress into more severe diseases such that the people get wounds on their feet or their ankles that don't heal, and it actually can lead to amputation, and that's a very severe problem if not recognized early.
Definitely. Okay, so let's go ahead and talk about diagnosis. How do you guys diagnose?
Sure, it's as simple as an ultrasound, and we do some blood pressure measurements, and that basically tells us where a blockage might be, how many arteries might still be open, going to the foot, and it tells us how much blood is flowing to a foot or a toe compared to an arm, and that really gives us a lot of information. And we can do that right here in our office.
Amazing. Okay, well that is huge. Let's talk about the procedure, and especially after the procedure too. What can people expect both during the procedure and then following it?
Sure, so as I mentioned, we do these procedures generally with not needing an anesthesia, not needing a breathing tube. We give them some light sedation, makes patients comfortable, and some numbing medicine. And then when we're working on the leg and the vessels and the arteries, it doesn't really hurt in there. We basically put little wires. The hole that we make is about 2.5 millimeters big, so very small.
Yeah.
And we use balloons or stents to basically open up that blood flow, create a pipe that used to be like this, went to this, and now we're making it back to how it used to be, a big open pipe. And generally these procedures take 2 to 3 hours.
Okay.
Recovery is another 2 hours, so usually better half of a day spend with us here. But after that, you go home the same day. You're walking, and basically 24, 48 hours later, you're essentially back to completely normal activities, hopefully even better than you started.
That's huge, and I think for so many people, that's a huge sigh of relief, knowing that, like you said, we don't have to go to the hospital, we don't have to get a full-on surgery done. We come here, and we can be better the next day.
That's the goal.
That's huge. Okay, so where can angiograms be performed?
So here in our outpatient-based lab, which is basically a full-on suite that we have in the back of our office with nursing, everything's monitoring. It's a very safe place, very clean.
Yeah.
But sometimes patients need to go or prefer to go to the hospital, which of course we can do those there too.
Sure.
Sometimes we can put patients to sleep if they strongly desire it, but we like to prevent that as much as possible just because it's much safer to do it the other way.
Definitely. Okay, so I'm sure there are people at home that are saying, hey, I have some of these symptoms. Maybe this is something that I should be getting checked out. What are the next steps?
Honestly, the they can have their primary doctor send a referral to our office, which we can then get them in pretty quickly to do an ultrasound and have a clinic visit with one of our excellent staff. Once they kind of review the ultrasounds and talk to the patient, if they're appropriate for a procedure, we'll do it for them. If not, if it's something else, we can work that up. And if it's something outside our specialty, we have many other specialists here that we can connect them to.
Amazing. Well, you guys are doing incredible work and making it so much easier for people to say, hey, I need to get this done. So, doctor, thank you so much.
Thank you.
The doctors at RIA Endovascular use minimally invasive treatments. Give them a call at 720-493-3406. Ask your questions and learn your treatment options. Learn more at riaendovascular.com. They